Good afternoon, everyone. This is Dr. Bhupesh from Dr. BKM OET Institutes. Yesterday we learned that how to do reading part C and reading part B. So the main things that we learned yesterday was basically again. Sorry, I will not. I don't need the notes. I need the pages. Yeah. So that's the pages. Okay. So things we learned yesterday is again do only easy questions first. And the major thing that we discussed, the major thing, the most important and the most productive thing that we discussed in that is what do you mean by do easy question first? Is that you do only easy questions and difficult questions should be done later so that you can save time. So the focus we created was that part B should be completed in 8 to 10 minutes, and there would be around 4 to 5 easy questions. I would say on an average 4 questions should be done in 8 to 10 minutes, and then by the 11th minute maximum you should be at part C. Anybody who takes 15 minutes in the part B, even if they do all the 6 questions, because you can't guarantee that 6 questions would be right, maybe 4 will be right, 5 would be right, so you can't guarantee. So if you do 6 questions in 15 minutes, then dear guys, now you have 30 minutes and the amount of questions that you have to do is 60. So you have disturbed the ratio. The major thing that happens is that whenever we start any reading, we think that initial questions are very important. If you will think nicely, then 90% of the time, last questions are always easy. This is the technique. This is the same technique that happens in part A. Part A, again, I'm telling you, people, even after telling 1,000 times, some people will say, Sir, I start from question number 8. Please don't start from question number 8. Start from question number 1. Condition is that 1 to 7 question where you have to say A, B, C, or D, you just will take 2 minutes. You will not take more than 2 minutes. Whether you do 4 questions, 3 questions, or 5 questions, that is your choice. How many you found, how many you find. But but don't go beyond two, maximum 3 minutes. If you are wasting your 5 minutes in 1 to 7 question, or you are starting from eighth question, you are in trouble. I will apply the same technique for you guys to this reading. Thanks to the person who has created this reading, or to the institute who has created this reading. This is oetonline.net AU. The main focus again being Dr. BKM Institute is to teach you how to do it. So I'm starting from here. First of all, I will read the questions. My clock is showing 10 minutes. So my reading should finish by 25. I will try that, but main thing I have to teach you as well. So in exam, what will I do? First of all, I will read 1 to 7 questions all together. Question number 1. In which text can you find information about the signs that indicate characteristic of hypothyroidism? So first question is about signs, symptoms and signs. Done. So always underline signs. In which text will you find the information about the use of ultrasound scans when assessing thyroid function? Symptom, signs, assessment, and scan, ultrasound. These are the keywords. In which text can you find the information about the reference ranges for thyroid function test? Reference range. Range means 0.02, 0.5, 2, 3. Means there would be some numbers and there would be thyroid function test. Done. Question number 4. So now we can understand signs and you will underline these words. On computer it is difficult, so I'm doing it with laptop, but in page it is much easy. Signs, underline. Assessment, underline. Thyroid function test. Range, thyroid function test. Fourth question, in about the hormones which it determines. Hormones is the important word. In which text you can find the treatment options for Hashimoto's thyroid treatment? In which text you will find the information about different types of thyroid conditions? In which text you will find the dosage rates for the thyroid replacement medication? Medication means treatment, so you have to relate. Medication means treatment. So now you simply go to ABCD paragraph. You have read 1 to 7 questions. By the time I am going to this part, I can see one word Hashimoto's thyroid. So this can be this. I can see various kind of tests. I can also see ultrasonography. So this word also I can see. And then there are symptoms. Assess word is given. Assess functional status. So means there are automatically I can see the words testing recommendations. So these are the tests. And in the C, they are showing the notes and they are saying labor. Then they are thyroiditis word again. Hashimoto's again is repeating 90% this. And D part, this is again invalid. Yeah, D part they are talking about the treatment and dosage. So I can do three questions right now, even without reading anything. I have just read in the first paragraph, they are talking about physical examination. So physical examination means like in writing, say, on examination, patient was found with. Means the signs should be here. Symptoms and signs should be here. Is an autoimmune condition. Then definition, signs, tests, thyroid levels chart, levels low, high, and then treatment. That's it. So if I have to do the questions, I will take your help as well. So I'm doing questions blindly and I'm putting you on unmute. So please keep your mics okay so that there is no background noise. I really want you to participate. Thank you very much. In which text you will find the signs indicate signs in part A, science part A, generally.
Yes, sir.
Yes,
Yes,
sir.
sir.
Ultrasound scans when assessing thyroid function. Thyroid function and assessment, we read the word assessing thyroid function this, and whether by chance, but diagnosis word is also given. So I will take B, or otherwise if I can find ultrasound word, that would be really means the main thing. But if I don't find the time, my answer should be B. So second I am doing B, but this I am not sure because I haven't found this easy word. This question I will never leave. In means in the first round, I have to leave it because the main thing that I want to do is to save time. Main thing is to save time. So again, this is what I want to teach you. Don't waste time. I am unable to find, but otherwise I will do B. In which test reference ranges for thyroid function test? Thyroid function test reference ranges maybe was given in low, high, that was in the C. But again, I'm not concerned about the answers at the moment. I'm just teaching you how to do that. In which test hormones which determines the status, hormones. Let me check out the TSH hormones. So this is the 100% C. Thyroid hormones is 100% C. Vidhi, if you can control your mic, please. Then again, going to question number 4 or 5, they are talking about treatment. So hormones wala I am 100% sure. First question I was almost 100% sure. Means 100% is nothing, 99%. Treatment option D. Then in which text you will find different type of thyroid condition was given in C. Maybe when they were talking about different kind of thyroids, it should be in A or C. Yeah, different kind hypothyroidism. So I think it should be in this, or maximum it can be in A. That different type of thyroid can be in the introduction. But I think it's also in the part C. And then I go to the treatment options. Dosage rates for the thyroid replacement medication dosage is given in 100% D. So I have done almost all the questions, but I am sure about at least 4 out of 7. Means second, third question, what I will do, I will put a dot in the final exam that I have to recheck. This I am not sure, and I don't want to miss out on this. Now, if you want to help me, you can, but otherwise I will continue with the flow. Now I'm teaching you the method. What is the benefit of this method? Now let's go to question number 8. What can be the face of a patient? Face of a patient look like means they are talking about symptoms and signs. Again, I will not check any other paragraph apart from it. This is where I save time. That is why I never say start from it. When you start with the strategy that you do 1 to 7 question, you try to understand where it would be given. So in the 8th question, I will also try where it would be given. So my mind will start working like that. Patient has high blood pressure. What does it actually indicate? High blood pressure, it can be either in A, and also these words would be easily visible, high blood pressure, or can be in the assessment, diagnosis wala paragraph. So can be in the B. Which test is often required? Which test is often required? Again, they were talking in the thyroid wala paragraph. So suppose if I have to say which test is often required to understand TSH results. Okay, I will go to word TSH here. And if I can see test, it's not given over here. Yeah, to detect any this, I think this is given in the assessment part. Assess the this should be in the presence of suggestive symptoms. A TSH, thyroid stimulating hormone test should be done.
And T4 test.
Sorry, Vasanti, I hope you are not talking to us. Okay. So this also I can do thyroid stimulating hormone test. Otherwise, I cannot find any other test. TSH test is the only word that is given, as far as I think. So I can do questions this way. So this is what saves time. So I need a bit of your help now, because strategy is, again, suppose if I do question number any of 18, irregular margins in the patient will with nodules may indicate. Irregular margins would be either, it cannot be in the treatment part, can be over here irregular margins, or can be in the assessment part. Irregular margins will indicate, yeah, here I can find. See, that is what it is all about. Irregular margins, that means you are trying to assess the patient. So you will go in this paragraph. So now once you have find a nodule cystic defining feature suggestive of malignancy, so malignancy becomes my answer. Means, again, I will tell you, first of all, I find the location, then I will read the question again. Question number 18, we were doing by chance. In a may indicate, may means probably, may indicate malignancy. That was the only word that was said over this. Suggestive of malignancy, such as this. That is how simple it becomes. Now I take a random question 16, suppose it. 16, non-thyroidal illness can be detected via. Now again, they are talking about test, so it can't be in this, it will be in this. So I just have to find non-thyroidal word. Non-thyroidal illness would be given in this or in the part A, but most probably would be given in this only. I just have to find the non-thyroidal word. Where it is? Anywhere can you find non-thyroidal?
Sir, T3 test,
T.
last word.
Last. So means, see, even in this, it takes time to find out where it is. So if you are finding every question from A, B, C, D, understand how much time are you wasting. So if you know where it is, then it saves your time. That is the simplest trick. Again, sir, how much time can we save? Only 5 seconds per question. My dear, 5 seconds per question means 5 into 20. 20 questions are there. 100 seconds. And 100 second means 1 minute and 40 seconds. More than 1.5 minutes. In 15 minutes, if you can learn this strategy, you can save around 2 minutes. That means normally if you have 15 minutes, it will appear to you that you have 17 minutes. So that is what is the technique. So once you finish these questions, then you will go to those questions where you have put dots. You will immediately go to 1 to 7 question. Then you will see where dots are given. So ultrasound scans, now if you find it, obviously scan word is given over. Ultrasound scans should be given over here. Should be in the part B anyhow, but I am still unable to find ultrasound scans. Ultrasonography is ultrasound scans only, or is it given in part A? Or is it given in part B? Part B itself, no? It should be in the part B otherwise.
Text
Part B.
B,
Yes, part
Part
B.
B. So even I have,
text B, sir.
yeah, even if I have not found the word, still my answer would be correct, because I know that should be given. So that is what is the technique. You have to understand this thing, and that is how strength will come. Like if I say third question, we reference ranges for thyroid. I think this is the only range that was given of thyroid high normal, so it should be C. So it was also correct reference range.
Yes, sir.
It was also correct.
Correct, C.
Yeah. So that is what you need to learn. So your reading will become a cherry cake walk. And in all the questions, you have to keep your mind that way. That if you do question number 8, you again say, where should it be? A, B, C, D. So you don't have to go to A. You will just see, chances are it should be in C. You will do that question first. Then if you do not find that question in that particular paragraph, you try to see that, otherwise you leave that question. Anybody having any question can ask, any doubt can ask me about this. This is the simplest thing I can teach you. Means that is how easy OET is if you follow the right strategy. In part B, not more than 8 minutes, maximum 10 minutes. The person who goes up to 15 minutes in the part B, exam is gone. In the same way, in the part A, anybody who is doing 1 to 7 question and he is thinking, oh my God, I have done all the 7 questions right. But my dear, if you have taken 4 to 5 minutes, I'm sorry, you will never be able to complete your exam today. It won't happen. That is the maximum times happening with the people. They are trying to do all the 7 questions because they think it's just ABCDR. Let me make my 7 marks sure. But in that quest, they lose everything. Is it all right for for everybody? Anybody wants to ask anything, please feel free. Anything that you have not understood. You have not understood. Today, I don't know what has happened to my English as well. But yeah, main focus is how to. Now, if it's the average medication dose, obviously I will go to paragraph D. The amount of the
Sir,
medication,
15.
okay, sorry, I will do that, Jovan. 19 medication, I will go to D. This medicine, I will go to D. And then 15th question is this a patient dash can a patient's means apostrophe s means they are talking about his or her means a patient's dash can affect the symptoms, a type of symptoms they display. A patient's dash, again symptoms should be in the paragraph A. Should be in the paragraph A maximum times. So a patient's dash, so I have to find something like a patient's dash. uh, just a second, I have to make it little large so that I can see. A patient's dash can widen this age. So it becomes cherry cake work for me because see, I can spend more time at A because I know symptoms should be here. Then I can say physical findings and depend on other factors such as age. Again, there are 3 rules which are working in finding one question. How did I find it? 3 rules. Ram apostrophe S. Apostrophe S means Ram's belonging, Ram's brother, Ram's pen, Ram's mobile phone, Ram's belonging. In the same way, patient's belonging. So I was trying to find something, patient's blood pressure, patient's dash. Then I understood the question that there is something that can affect. So I understood age should be the word that can affect. Patient's age is something that can affect. What is that? That can affect uh, symptoms of the display. And over here they were saying, physical findings are variable. Physical finding means symptoms and signs are depend upon the extent and other factors such as age of the patient. So I can understand they were talking about patient's belonging and age is one of the belongings. Do you understand, guys? Any doubt? Any other question in this?
Sir, 17.
7.
Question number 17.
Can you put it on mute, ma'am, again? So if I do 17, check for a. Never forget the articles. A word, if given, then 90% in the paragraph also, the answer would be after A. Check for a dash if a patient returns a high result in all tests. So test was given in which part? Test was given in which part, guys? In the B part. Check for a dash. So immediately I will go to B part. Check for a dash. A word is given a serum TS test. Check for a dash. And what were the other lines? Check for a dash. Just a word. I need another keyword. I have missed out on the keyword. Sorry. And that is why I say computer test should never be taken by a medical
Sir,
professional.
it's in text C. Answer is in text C.
Sure, ma'am. I will try to find it. What was the question number 13?
Sir.
Ma'am, you have to be little patient. In which text? Sorry, in question number was what question number we were doing?
Sir, 17.
17.
Check for a dash if patient returns a high results in all tests. Sorry, check for a dash. All right, I got your point. So it is given in the C part where
The key
high
keywords
were
high
given.
result.
Yeah. So it was high word given. Madeline, I would really request when I am trying to teach you, if you will not tell me answer, you will learn more because it takes time to find the now if you will tell the answer, there is no point of me to find it. But anyhow, we are way ahead. We have almost completed our reading. So that was the word we were looking for. Okay. So again, I don't know now. It would be hard for me to do because once I know the answers, I'm unable to do these things. Yeah. Any other question apart from 17? What was the problem in 17 question, ma'am? What did you find as a problem? What was the problem in
Sir,
17?
sir, the answer is lab error,
Hmm. Hmm. So, ma'am, lab,
but we wrote TSH.
nahi, that is the problem. See, high is over here as well as over here. There are two highs which are given. Check for a TSH or check for a lab error. What is better? Means they are saying if all the hormones are high. That is what they were saying. Let me check. We have to find the keywords. That is how it becomes easy. So you did that because I also did that, but there were two highs that were given, and we had to find check for a dash if patient returns high result in all the tests. What are the tests? What are the tests? TSH, T4, and T3. These are the tests. So they are talking about these high. So if all the TSH, T4, and T3 tests are high, then you have to check for level. So obviously this was a better one. It does not make sense. Check for a TSH if all the tests are high. If all the tests are high, there can be a lab error. That means there can be error from the laboratory because it can also occur with thyroid secreting tumor, which is rare. So first of all, if your T4, T3, and TSH all are high, that means you are having maybe this thing. Is it all right, guys? Any other question that you would like to ask? Any other question, please, guys? So I hope this is good enough. And even you won't believe, guys, you won't believe. We have discussed, we have talked, we have done so many things. I started at 10. Right now, the clock is at 28. Even after discussing everything, it has maximum taken 18 minutes. I know you get 15 minutes, but we have discussed so many things. So if you know the techniques, if you know is important, in this A word was not playing its role, but 90% it will. Always take care of the articles. Always take care of the prepositions for, from, by. They are the hints that words will be attached to it. And then we did simple things. So this reading, I would grade, this was kind of an average reading. I won't say it was very difficult, but it was little difficult because like in this question, TSH for high was here and here. You have less time. So how can you basically drop your anxiety? Suppose in exam you won't have the time. You will do TSH. Maybe I will also do TSH. The person who will do 4 to 5 questions in 2 minutes in the start will always have time. He will not create panic. He will find. That is where the mistake happens when you take 4 to 5 minutes in 1 to 7 questions trying to do everything right. And that will not happen. This is Dr. Upesh from Dr. BKM Mohit Institute. Please watch this video 10 times. Oh, sir, we have understood. Why should we watch? We will follow your technique. No, we are humans. We don't change that easily unless we listen to someone 5 times, then we practice it, then we again practice it, then again we doubt, then again we listen to that person, then again we practice the same method, and then the magic happens. So magic does not happen in one shot. That is the problem. So you have to understand this method. You can't start from question number 8. You can't give 4 to 5 minutes in question number 1 to 7. If anybody is struggling with time in the reading part A, I guarantee you, either you are starting from question number 8 or you are taking 4 to 5 minutes in 1 to 7 question. That is the reason. Thank you very much.